Good morning. Dr. Ken Dietrich here from Summit Pacific Medical Center, and I'd like to take a moment to just talk briefly about the new latest CDC guidelines related to COVID-19 and masks. So as you know, wearing masks has been shown to be very effective at helping us curtail the spread of the infection and the transmission of COVID-19. As more people have become immunized, the rate of transmission has been going down, and the CDC has recently provided guidelines for those who have been immunized. The great thing about being immunized is our risk of contracting COVID is less than 5%, and of those who might contract the disease who have been immunized, the symptoms are typically very mild. And so we want to encourage people, please get immunized. There's basically two types of people going forward. There's going to be those who have immunized and those who have gotten the infection. And that's because, as you know, this is a very contagious disease. So putting in a plug-in for you to please consider being immunized. Secondly, regarding the new guidelines that you don't need to wear a mask out in public or in private settings if you've been immunized, can be a little bit confusing, especially as I'm sure you are, as well as most Americans, including myself, are kind of tired of this COVID thing. And we'd like to take our masks off and just go about our business. If we look at the CDC guidelines a little more carefully, we're going to discover that it's not just a blanket, you don't need to wear a mask anymore if you've been immunized. There are specific settings where wearing masks is continued and mandatory and required. And that setting that is particular for us today is the hospital. So coming into a medical care facility where it's common for people who are immune compromised, people who are coming in that are ill, who are probably potentially infected with COVID or other infections, it's very important that we continue to mask, social distance, and do proper hand hygiene. So even as our county and our state begins to open up, and as more people become vaccinated, I anticipate that the requirement to be fully masked, to use hand hygiene and social distancing will continue for hospitals and healthcare settings for the foreseeable future. So please be prepared for that when you go in to see your provider in a clinic, in a hospital setting, and please be patient with the staff that are requiring that. Because it's not only to protect you from contracting something, but also to protect others. Keep wearing your mask when you're coming in if you need to be seen. Keep doing your hand hygiene and your social distancing, and stay healthy. Thank you.